Howdy. These are our group members and our roles. And today, our topic is antibiotic use in the livestock industry and its impacts on human health. We're focusing on antibiotic residues in food products and the acceleration of antimicrobial resistance. Antibiotics are essential for treating and preventing disease in livestock, but their overuse has become a major concern. Excessive antibiotic use can negatively affect both animal and human health, which makes this issue highly relevant today. Antibiotics are used to prevent and treat infections in livestock, helping animals stay healthy and safe for human consumption. Looking at the graphic we used here, you can see that when antibiotics are used unnecessarily, bacteria can adapt and become resistant, meaning the drugs no longer work effectively when needed. These drug-resistant bacteria can spread to humans, limiting treatment options as well as effectiveness for both humans and livestock. Antibiotic-resistant bacteria do not remain isolated in animals. They can spread to humans through contaminated surfaces, animal waste, water, and soil, even without direct contact or consumption of meat. This poses serious health risks, as humans may lack the immunity needed to fight these resistant bacteria, leading to longer and more severe illnesses. Popular press sources generally agree that antibiotic use in agriculture is a major driver of global antimicrobial resistance. The effects extend beyond livestock, impacting the environment through soil, water, and manure, and ultimately human health through multiple contamination pathways. While the press recognizes the seriousness of the issue, it also highlights economic incentives and weak regulation as barriers to change. Effective solutions must balance public health, economic interests, and policy reform. On the other hand, the scientific community acknowledges that antibiotics improve livestock production efficiency, but warns of significant negative health impacts on humans. Research consistently links livestock antibiotic use to immune suppression, chronic infections, and other health issues in humans. Scientists emphasize that the main challenge is not proving the harm, but prompting change and innovation. Developing safer alternatives such as probiotics, prebiotics, and phage therapy to reduce antibiotic dependence. Overall, scientific evidence strongly supports the need to limit antibiotic use in livestock to protect public health. Now, throughout our presentation, we've discussed how antibiotics are used in livestock to prevent and treat diseases, but overuse has created major issues. This overuse contributes to the rise of antibiotic-resistant bacteria, which can spread to humans through food, water, and the environment. Both the popular press and scientific research agree that while antibiotics have benefits, their misuse poses serious health risks and requires immediate attention. As a group, we believe that antibiotics should be used responsibly and only when necessary to maintain animal health without compromising human safety. This project taught us that balancing product production efficiency with public health is complex but vital. We also learned that progress depends on awareness, innovation, and stronger regulations to ensure antibiotics remain effective for both animals and humans in the future.